So in this I will be discussing about the chronic inflammation. So this inflammation is asked as an essay topic in the university exam. So what is meant by this chronic inflammation? So it is a response of prolonged duration, that is to weeks or months, in which the inflammation, tissue injury, and attempt to repair and the attempt to repair it coexist in varying combination. So this is meant by chronic inflammation. So this may follow acute inflammation, or the chronic inflammation may begin insidiously as a low grade response without any manifestation of a preceding acute infection. So this chronic inflammation, it is characterized by infiltration. There is infiltration of tissue with mononuclear cells. Mononuclear cells such as the monocyte, macrophage, and the lymphocyte. So there is infiltration of tissues with the mononuclear cells. There will be tissue injury and the chronic inflammation, and at the same time there will be attempts of repair. There will also be healing which is happening. So now the cells of inflammation. The cells of the chronic inflammation is the monocyte. When the monocyte reaches in tissues, it becomes the macrophage. So the monocyte. So when the cell is produced in bone marrow, so from hematopoietic stem cell in bone marrow, the monocyte is produced, and the lifespan is 1 day. Whereas when this monocyte it go and reaches to the tissues, this becomes the macrophage, and the lifespan of the macrophage the lifespan of this macrophage is months to years. So in different organs, the macrophage has got different names. So for example, in spleen, the macrophage is called as the littoral cells. In the liver, it is called as Kupffer cells. In the kidney, it is called as the mesangial cells. In the lungs, this is called as pulmonary alveolar macrophage. It is otherwise known as the dust cells. In lymph node, the macrophage are called as sinus histiocytes. In the bone, we call it as osteoclast. In the placenta, so the macrophages are called as Hofbauer cells, whereas in the brain, it is called as microglia. So the macrophages are known by different names in different organs. So in spleen, it is called as littoral cells. In liver, it is the Kupffer cells. In kidney, the mesangial cells. In lungs, the pulmonary alveolar macrophage or the dust cells. In the lymph node, sinus histiocytes. In the bone, osteoclast. In the placenta, Hofbauer cells. And in the brain, microglia. So, the role of macrophage. Actually, the combination of the WBC, infiltration, then the tissue damage, and this fibrosis that actually characterizes the chronic inflammation. It is the result of the local activation of several cell type, and there is production of mediators. So, macrophage is the dominant cell. It is a dominant cell in most chronic inflammatory reactions. So it is a dominant cell in most chronic inflammatory reaction. Actually, this macrophage, it secrete cytokines and growth factors. It secrete the cytokines and growth factors. So this will go and act on various cells. Various cells. This will destroy the foreign invaders. It act on various cells. It destroy the foreign invaders. Foreign invaders and tissue, and this cytokines and growth factor, it also activate the T lymphocytes. So activate other cell types such as T lymphocyte. So we can say that the macrophage are the professional phagocyte that eliminate the microbe on the damaged tissues. They also serve a very important role in the repair of damaged tissue. During early development, these macrophages are obtained. Macrophages are obtained from the progenitors in the embryonic yolk sac. Embryonic yolk sac and in fetal liver. So the macrophages are normally diffusely scattered in the most connective tissues. So these all macrophages which are present in specific location in organs. So together these forms the mononuclear phagocyte system. Phagocyte system. Earlier, it was inaccurately called as the reticuloendothelial system. Reticuloendothelial system. But this term is now not used. So the specialized type of macrophages, such as the microglia, Kupffer cells, alveolar macrophages, they arises from the progenitors in the yolk sac or the fetal liver very early in the embryogenesis, and they migrate to the developing brain, liver, and the lungs, where they persist throughout the life as a stable population of resident cells. So when there is an inflammatory reaction, the monocyte, it begins to emigrate into the extravascular tissue quite early, and within 48 hours they may constitute the predominant cell type. The extravasation of this monocyte, it is governed by the same factors of neutrophil emigration. So we are having this macrophage, and this macrophage goes into two pathway. So one is a classical activated pathway, that is through M1, also called as M1, and the other is alternatively activated pathway through M2. So the classical pathway, it is activated by, so the classical pathway, it is activated by TLR, that is toll-like receptor, interferon gamma, whereas the alternative pathway are activated by the interleukin 4, interleukin 13. So when this is activated, they form the reactive oxygen species, and this reactive oxygen species, it go and kill the microbe. Through classical pathway, when activated, the macrophage will produce interleukin 1, interleukin, interleukin 12, and interleukin 23. So these interleukin will leads to inflammation. So when the alternative pathway is activated, it will release the transforming growth factor beta, and this transforming growth factor beta, it will lead to fibrosis, and the macrophage through the alternative pathway, when activated, it release interleukin 10 and the transforming growth factor beta, and this leads to the fibrosis and the anti-inflammatory effect. Anti-inflammatory effect. It is because the inflammation has to be checked. So that is why the anti-inflammatory effect. And in chronic inflammation, the lymphocytes, that is the B and T lymphocytes, then the CD4 plus lymphocyte. So they are important for chronic inflammation. They are important for chronic inflammation. Now, the granulomatous inflammation. So what is this granulomatous inflammation? So, so granulomatous inflammation, it is also a form of chronic inflammation. So it is a form of chronic inflammation, and it is characterized by there will be collection of activated macrophage. So there will be collection of activated macrophage. Then there will be T lymphocytes, and sometimes they are associated with a necrosis. So the granuloma formation, it is actually the cellular attempt to contain an offending agent, and which is difficult to eradicate. So now what is a granuloma? So this granulomatous inflammation, it is asked as a short note. So in granuloma, there is actually the epithelioid cells. There is epithelioid cells. In center, there is the caseous necrosis. So there is the caseous necrosis. And you have the giant cells. You have the giant cells. So these are the giant cells. And there is the collar of lymphocytes. The collar of lymphocyte. So what is a granuloma? It is a collection of the modified macrophage. So this modified macrophage, that is called the epithelioid cell. Epithelioid cell. So this is the modified macrophages called as a epithelioid cell, and they are surrounded by collar of lymphocyte. So they are surrounded by collar of lymphocyte. So sometimes they can have necrosis, and sometimes they can have the giant cells. So what is a giant cell? Before knowing the giant cells, what is an epithelioid cells? So these are a modified macrophage or the activated macrophage. So why it is called as epithelioid cells? It is because it is having an epithelium like appearance. Epithelium like appearance, and this epithelioid cell, it accumulate large amount of cytoplasm, large amount of the cytoplasm, and the nucleus, it becomes slipper shaped. Slipper shaped. So now what is the giant cells? So these giant cells are formed when few epithelioid cell When few epithelioid cell fuse, they form this giant cell. So, so due to that fusion, it may contain it may contain a number of nuclei. A number of nuclei. There are actually various types of giant cells seen in different conditions. So we have the Lang Langhan Langhan's giant cell. Langhan giant cell. So in the Langhan giant cell, there is the nucleus are arranged like in the periphery. So you can see the nucleus at the periphery in a Langhans giant cell. So there is peripheral or necklace necklace arrangement of the nuclei in Langhans giant cell. So this is seen in TB. In TB, Langhans giant cells are seen. So the next type of giant cell, it is foreign body giant cell. Foreign body giant cell. It is having, so the nucleus of the foreign body giant cell, it is arranged as haphazard. So this is called it is having haphazard arrangement haphazard arrangement of nuclei. So this is seen in if there is a foreign body such as talc or the sutures in surgery. Sutures. So in that type of granuloma, you can see the foreign body giant cells. So now the next one is Ashkoff giant cell. Ashkoff giant cell. So the Ashkoff giant cell, it is seen in rheumatic heart disease. Rheumatic heart disease. So the next one is RS cell, that is Reed Sternberg cell. So the characteristic of the nuclei in RS is they will have, it is binucleate. There is two nucleus and there is a prominent nucleoli. This is seen in Hodgkin lymphoma. So this is seen in Hodgkin lymphoma. It is binucleate with the prominent nucleoli. So the next one is the Toton giant cell. So the Toton giant cell, it is having foamy cytoplasm. It is having foamy cytoplasm around the nuclei. And this Toton giant cell is seen in xanthoma. So the next type is Warthin Finkeltley giant cell. Warthin Finkeltley giant cell. So this is seen in measles. Then we have inclusions in giant cell. So this is seen in sarcoidosis. So in sarcoidosis, inclusions of asteroid bodies because they are star shaped, and Schumann bodies. Schumann bodies. So this is it is a focus of calcification. It is a foci of calcification. So they are seen in sarcoidosis. Now about the mechanism of the granuloma formation. So what is the mechanism of the granuloma formation? So basically the granuloma formation, it is a type 4 hypersensitivity reaction. It involves the it involve the CD4 plus cells which produce the interferon gamma. So this interferon gamma, it convert the macrophage into the activated macrophage. So this is activated. So this activated macrophage can be called as the epithelioid cell. So this is the epithelioid cell, and this epithelioid cell forms the granuloma. Now what are the types of granuloma? Now about the types of granuloma. So one is the foreign body granuloma. We have the foreign body granuloma. For example, talc suture. In this, there is no immune reaction. There is no immune reaction. And here I have said that the foreign body giant cells are present. Foreign body giant cells are present, and in this the foreign body can be seen as a refractile material. For example, the talc and sutures. So the second type of granuloma is immune granuloma. So in immune granuloma, there is type 4 hypersensitivity reaction, and it involves the interferon gamma. Now the granulomatous disease and the different type of granuloma. Different type of granuloma. So the various type of granulomatous disease are TB, sarcoidosis, cat scratch disease. Then you have syphilis, leprosy, vaginous granulomatosis. Granulomatosis. Then you have Crohn's disease, Church Strauss syndrome. Then there is lymphogranuloma venereum. Then there is berylliosis. So these are the various granulomatous disease. So the, there is so one type of granuloma is the caseating granuloma. Caseating granuloma. So this caseating granuloma, it is seen in TB, then certain fungal infections like histoplasmosis. It is a fungal infection. Then coccidioidomycosis, and in case of tertiary syphilis, you can see caseating granuloma. Caseating means it is cheese like. So there is in the H&E staining, you have the granuloma with the Langhans giant cells and lymphocytic color in the caseating granuloma. So next one is naked granuloma. So in the naked granuloma, the lymphocytic color, it will be absent. So the lymphocytic color will be absent and it is non-caseating. Non-caseating, and this condition, it is seen in sarcoidosis. It is seen in sarcoidosis. Now the next one is non-caseating granuloma. So non-caseating granuloma, it is seen in TB, Crohn's disease, and in Hodgkin lymphoma. So next is the palisading granuloma. So in palisading granuloma, so this is seen in vaginous granulomatosis. Granulomatosis. Then we have eosinophilic granuloma. Eosinophilic granuloma. So this eosinophilic granuloma, it is seen in Churg-Strauss syndrome. So this is it is actually Churg-Strauss syndrome. Next is the donut granuloma. So this donut granuloma, it is seen in Q fever. Then you have the stellate granuloma. Stellate granuloma. So it is seen in this cat scratch disease. Then you have Dirk's granuloma. So this Dirk's granuloma, it is seen in malaria. Which malaria? That is a Plasmodium falciparum. It is seen in Plasmodium falciparum. So these are the different types of granuloma. Now, coming on to the systemic effect of inflammation. So what are the systemic effect of inflammation? So in systemic effect of inflammation, there will be fever. So the fever is because of the prostaglandins, the interleukin 1, interleukin 6, the tumor necrosis factor alpha. Then there will be acute phase reactant. So the acute phase reactant includes C reactive protein, the fibrinogen, then serum amyloid associate. Serum amyloid associate. So the high sensitivity. So if the level of high sensitive C reactive protein, if the level is rising, there is increased level of cardiovascular diseases. The acute phase reactant, we have positive, actually the acute phase reactant. So in acute phase reactant, we have the positive acute phase reactant and negative acute phase reactant. So the positive acute phase reactant means these will increase during inflammation, whereas the negative acute phase reactant decrease during inflammation. That means their level will be decreased. So what are the inflammatory acute phase reactants that will increase during inflammation? So they include the C reactive protein, the fibrinogen, and MBL. So these will act as opsonins. Then you have the factor 8 von Willebrand factor and prothrombin. So these are involved in coagulation. Then you have serum amyloid, serum associated amyloid, serum amyloid associate, haptoglobin, and ceruloplasmin. Ceruloplasmin. So these will decrease the growth of microbe. These will decrease the growth of microbe. So which are the negative acute phase reactant? So the negative acute phase reactant includes the albumin, then you have the transferrin, transthyretin, transcortin, then binding retinol binding protein. So these are included in the negative acute phase reactant. So that's all about the chronic inflammation.